Hi, I'm Connie Perry. I teach bioethics classes. I teach at the undergraduate and the graduate level, and I've been working here since 1991. I have a doctorate in philosophy. I'm an actual philosopher. I am currently Drexel's ethicist for their Animal Care and Use Committee, so any use of animals in the university for research or education, they go through the IACUC. I've been on several committees that were interdisciplinary, looking for ways to solve problems. For example, how do you help with women who have HIV and are pregnant and they want to provide the best life for their babies and the best health for their children as well as for themselves. And we work with everyone from peer counselors to administrators in hospitals and people providing care in clinics and such, to try to find ways to solve the problems that women face to improve their health and their well-being. And so that's kind of what I do. And then I do research.
So what's unique about our health administration program?
So many things, but the faculty members, even the bioethics faculty, all have experience in healthcare, right? They're also very focused on providing individual counseling and helping students succeed. Not just succeed in terms of getting grades, more so, succeed in life. What is it that you want to do? How can we help you network? I had someone who actually called up the CEO of Mount Sinai Medical Center in New York. She said, the worst thing that can happen is he says no. Well, he said yes. And so she got the interview. Healthcare has always been changing because it's built on research and science and such, and it deals with people, right? And we're always changing, right? But health, you can do almost anything. I have students who've gone into insurance, that have worked with the pharmaceutical industry, that have gone into work in hospitals, but I've also had students that have created their own nonprofits to focus on things like maternal health. I had a lot of the graduate students come with an idea of this is what I want to accomplish, and our faculty members are sit down with them and work out a curriculum that enables them to. I think the first thing I would advise is talk with your professors. Don't feel like, well, that's the professor and I can't talk. I'm just a first year, or I'm not even a first year. Talk to them. They want to talk to you and they will help you. Other things I would say, take some classes outside of your discipline. You're here at Drexel. Take some classes in biomedical engineering, public health, law. Be imaginative and constantly learn. We have connections with the West Philly community. We have the 11th Street Health Center, which is a nurse-run health center. Volunteer. One of the things that I did when I was learning how to become a bioethicist was I worked as an EMT, and that showed me how healthcare, from the moment of sickness or injury through to long-term care and sometimes death. It was very, so your learning doesn't stop when you leave the classroom. Enjoy it. I would just say be open to new experiences and ideas.